Okay, I think we'll start, and I guess some friends will join us throughout the evening. So welcome everyone to our Spirit of Work panel this evening, entitled Spiritual Lessons for Public Health from COVID-19. So we're joined with 4 amazing experienced panelists who I'll introduce shortly, and after I guess read their bios, they'll share with us a bit of maybe any changes in their work during this COVID-19 crisis, how they've been, I guess, working in public health during this time, and if they haven't, then how they've enjoyed lockdown and what they've been doing. So I'll start with the first one. So Dr. Dessi Dimitrova. Dr. Dimitrova is from Bulgaria and was educated in the USA at Dartmouth College, Bowdoin College, Princeton University, and in Bulgaria at the National Medical University. She has worked for McKinsey & Co., the World Bank, Dalberg Global Development Advisors, Results for Development Institute, and the Bulgarian Ministry of Health. She's now based in Switzerland, working for the World Economic Forum, focusing on health systems transformation. So Dessi, you can introduce yourself.
Sure, Ali, thank you for the kind introduction, and also thank you to EBBF for the invitation, especially to Mark, whom I've known for many years and who's been a mentor and a guide in my work. So thank you very much. It's a pleasure to be with you this morning here in Geneva. Should I give some background or just hello at that time?
Yeah, feel free to talk about your work in general and then what you've been doing over the COVID-19 period.
Sure, thank you. So the health work at the World Economic Forum focuses on answering the question, how are we going to deliver health and healthcare to the 9.7 billion people that we would have by 2050? And our theory of change is really doing it in 2 ways. One is by finding business models and incentives for companies to keep populations healthy, because in a way there is no business incentive for people to be healthy. They won't be necessarily consuming medical products. And the other one is when we actually do have populations that fall sick, how do we transform the healthcare delivery systems such that we can offer value-based healthcare and precision medicine so that their health is well cared for. And during the COVID crisis, we focused our work along these 2 pillars, looking at ways to accelerate vaccine development, therapeutics development, also making healthcare systems more resilient, and finding non-pharmaceuticals interventions to address and prevent the spread of COVID in Africa and Latin America as well. Thank you.
Thank you, Dessi. Sounds like you've been very busy then. And now I'll introduce Dr. Viliame Tuitone. Dr. Tuitone was born and grew up in Tonga. He attended Auckland Medical School and then undertook his specialist training in New Zealand and Scotland. Although Viliame is a kidney specialist, he has a special interest in health promotion and primary health. So Viliame, please feel free to introduce yourself and what you've been doing over this time.
Thank you, Ellie, and thank you, Mark, and thank you, everybody, for allowing this space for this fantastic collaboration and sharing our experience, and also some of the actions that will come along in the few questions to come. As per introduction, I'm very, very practiced in the narrow part of medicine, especially form of kidney disease. But as the time goes on, being a long time in Middlemore now since 2014, the experience is that non-communicable disease have a lot of hits in the Pacific people in Maori, culminating in dialysis. I feel myself at the bottom of the cliff in an ambulance, and rather rethinking of where I am in terms of the greater benefit, bring in the love for health promotion in primary health and trying to prevent this onslaught in the Pacific and Maori into dialysis, which is driven primarily by obesity and diabetes and all the consequences of obesity. But in terms of COVID-19, it's my work in Middlemore. We have to realign and restructure the service within Middlemore and within each department in preparation to cope with the onslaught of COVID-19 luckily that hasn't been materialized in the hospital in New Zealand. We're very grateful for that, but it's still early time yet. But that's where I am. We were contemplating a very busy Middlemore with COVID, but not really materialized. We're still very busy with the obesity and all the non-communicable diseases affecting our health. Thank you.
Thank you, Dr. Tutone. And then I'll introduce Dr. Suneva Sinclair. Dr. Sinclair was born and raised in Papua New Guinea and has worked in Samoa as a specialist public health physician. She has also worked as a consultant for the World Health Organization in the Philippines, China, Cambodia, Vietnam, the Solomon Islands, and Kiribati, and for UNICEF in Fiji and in the Secretariat of the Pacific Community in Samoa, New Caledonia, and Fiji. In 2013, she completed the Global Health Delivery Summer Intensive Program at Harvard University, and she currently works as a public health physician in Counties Manukau, DHB. So Suneva, please introduce yourself and share with us what you've been doing over this time.
Very much. Thanks for this space, and it's lovely to see everyone. Kia ora koutou, talofa lava. I work as a public health physician for the same organisation actually that Williami works for, Counties Manukau District Health Board, which looks after the health of people in South Auckland. But during this COVID-19 time, I've been seconded to the Northern Regional Health Coordination Centre, so looking at the COVID-19 response for all of Auckland, not just South Auckland, but all of Auckland and Northland, so a wider area. And I've been fortunate to be part of the Pacific team with that. Sorry about that. And spending some time within Auckland Regional Public Health Service, which has been really exciting. Specifically, we've had the opportunity to be able to work with the Public Health Service looking at the experience of Pacific families in Auckland who have been affected by COVID-19. So people who've come down with the illness and their family members, which has been, very insightful and eye-opening experience.
Thank you, Suneva. And last but definitely not least, we have Huti Watson. Mrs. Watson is a consultant with a broad range of knowledge across health, research, consulting, and economic development. She is the chair of a Maori Manuka Honey landowner collective, Ngāti Paru Mere, and deputy chair of Ngāti Paru Haura, a primary health organization with the only Maori-owned and operated hospital in the world. Huti is an alumni of the Atlantic Fellows Program, which empowers communities of emerging leaders to advance fairer, healthier, more inclusive societies. So Huti, please introduce yourself and share with us what you've been doing.
Kia ora, thank you, Ali. Kia ora koutou. Really nice to see everyone tonight. I haven't joined Spirit of Work before, although I've been meaning to, and so I wasn't really sure what how this would look. But thank you for inviting me. I appreciate it. So yes, I'm part of an organisation that is a subsidiary of our tribal runanga that provides health services to the Ngāti Porou East Coast region. And of course, you can imagine during COVID, we've been very busy. Our population have the highest levels of high need, high risk, chronic conditions in the country. And that's something that we've been working really hard to address for a few years. And so as such, we're obviously very vulnerable to COVID. So our checkpoints and all the different measures that we took to ensure that our community was protected were very well addressed by our runanga and by our communities working together. Very good example of everyone working together. We're really happy that, there was no spread of the COVID, but per capita, our testing was higher than anywhere else as well. So you can see how active our health services were. I'm also part of a very own project. We're very engaged in genetic research and to do with metabolic conditions as well. So Viliami has been along to a few of our hui, and so kia ora Viliami, and very much involved in the genetics of Māori at the moment. And so we have a Aotearoa-wide very own project happening, and we're very focused on precision medicine and getting that to work for us as a tribe. So yeah, there's a lot of work in there. But in terms of the COVID, I think that we managed well through that period. My role changed. I wouldn't say change. I'd just say I got an additional role during that period, not only to support our chief executive and our staff through, and to support, just to make sure that they were okay, but also to coordinate some of the community initiatives that were needed during that time, because obviously remote areas, remote Māori have specific set of problems. So I won't go on too much longer. Kia ora koutou katoa.
Thank you, Huti. And I'll just introduce myself as well. I'm Ali. I'm a medical student living and studying in Auckland and very interested in public health. So when I got asked to help moderate this panel, I was very excited. So thank you, Mark, and the Spirit of Work team. And I'll just introduce Spirit of Work as well before we get into the questions tonight. So Spirit of Work is a networking and discourse forum about the application of moral, ethical, and spiritual principles at work. It aims to bring together experienced and young professionals to share and learn about creating vibrant, sustainable, and productive work environments through the application of spiritual principles. Spirit of Work organizes sessions that provide fresh insight into applying spiritual principles to various aspects of work, and these principles take inspiration from the Baha'i writings and serve as a foundation for transforming work by contributing to individual development, organizational growth, and community flourishing. So I'm glad you could all join us tonight, and then we'll just go straight into the questions. So the first question which we're posing to our panelists is, what lessons have we learned and should we learn from a public health response to COVID-19 crisis? So if you don't mind, I'll ask Dimitrova to address this first, and then we'll give all the panelists a chance to share.
Thank you. Well, I guess in my way of looking at it, I think as a global society, we're learning a lot about how connected we all are and how we need to actually work together to be able to address problems that we may not have expected, or we probably have planned for to some extent, differing across societies, or have different levels of readiness for. But really, COVID-19 is showing us even more strongly that we are all connected, that we're all almost like cells of one body, or different parts of a human body, that when one part of the body is affected, it's not just, we can't just forget about it and leave it to be affected by itself, that actually this impacts on the whole body, and that we need to use our collective will and our resources to address it together, really.
Thank you, Suniva. Could I ask Dessi to share next? Maybe from a global perspective as well, what lessons are we learning?
Sure, Ali. And yes, it's interesting, when I was thinking of my response, I felt that the first and most important thing that we learned is the importance of community, just like Suniva is saying, that we're all very connected, and I know Huti knows best about it. But for me, it was quite an aha moment. I grew up in communist Bulgaria, and when I was introduced to the Baha'i faith and the idea of unity and the importance of community in driving growth, I always wondered, like, isn't it so much easier to get, you know, the guidance from above, and then we implement on the community level together. And throughout my life, and now with COVID, it has been really like an aha moment, how it's the community that actually drives transformation. But it's not just one community; it's a community in a sort of in a network or an ecosystem of multiple communities that are sharing with each other what their response is, and then on a global level, synthesizing that response and trying to provide guidance to these communities to find their own decisions, but finding the best practices and synthesizing them on a global level and then feeding them into the local level. And what we've seen is really it's the volunteers on the ground, it's the hospitals on the ground, the primary care practices on the ground that are addressing it. But without the global response and coordination, it is completely impossible. We saw in the first days of the crisis, we had companies that are saying we have one country that is ordering from us almost 90% of our total stock of, say, patient monitors. So if we give it to that country, we won't be able to ramp up production to be offering to other countries. Who needs to be the one that is looking at the global demand and supply so that we can provide in an equitable manner all the equipment and the essential products that we need. So in a way, it's neither or. We need global coordination because the world is very interconnected, but ultimately the action needs to take place on the local level. And the second piece is around it seems very obvious, but it's so hard to implement. It's around service and putting individual in the center. We've seen so much how this crisis has been politicized. And somehow we always think about how do we finance it, how would we reimburse, how do we ensure services continue. And I think that if we put the spirit of service in the middle and think about what is the impact of this action on the individual one by one, what is it on the elderly in institutions, what it is on the on families, we'll be able to transcend politics.
Thank you, Dessi. I think you highlighted really well the need for both global coordination, but then local action as well to handle such a global pandemic. Could I get Huti to share some thoughts now?
Sure. Thank you, Ellie. Yes, I think when I was, watching the New Zealand government response, I was reminded of, in the Baha'i writings, if you have an illness, then you're advised to seek the physical illness, and you seek the advice as a professional. And of course, this is what the New Zealand government did. They drew on expert advice based on epidemiological evidence and practice. They investigated, they tracked and traced the outbreak and controlled and eliminated the source, etc., etc. And it reminded me that it's absolutely key to seek professional advice and then implement it. So, but what we saw across the world was this broad spectrum of varying kind of actions and thinking, and it made it really difficult for a worldwide response to be coordinated, and it just brought to mind to me the need for, even more so in these times, some kind of entity such as a World Commonwealth that could be more well equipped to deal with these kinds of issues. Also, of course, never before have we seen anything happen like this in real time. Social media has been able to enable us to keep pace with what's happening around the world, as well as the different various media. And never before have we seen how obvious, the oneness of humanity is when you have a disease such as this that just, went through all of those barriers. And so this is what COVID taught me, is the importance of the oneness of humanity, and how we work together is going to be the key going forward globally.
Thank you, Huti. William, would you like to share some thoughts, finish up with this question?
Sure, thank you. I think we have to understand that COVID-19 is unique in a way that it's global. It affects everybody, whatever color you are, whatever ethnicity you are, whatever social hierarchy you are, you're all going to be affected. And I think it's manifested very much from a New Zealand perspective is unity. For me, I have a glimpse of what power unity is. The unity of actions, the unity of ideas and goals that we have. And that unity in New Zealand has been from different levels, from an individual family level to a community level, to some degree in institutional and governmental levels. And I think that has been shown us to our success yet to this time in our ability probably to eliminate the viruses. But it gives me the glimpse of that unit. But in a microscopic level within the hospital, this has brought out a lot of our noble characters. In our work, we have to realign our service and restructure in a way that will have to cope with an onslaught of the virus. It has to come through a consultative process. Every department have to actually divide into different teams. Who's going to do what, do this and do that. And we all are aware in hospital that we are the people who is high risk. If a lot of people come with COVID, we are the first people who's going to see them. So with that realization that we are all at risk with our family, our consultation was done with absolute fellowship, with love, because we know that we are the family, that we had to protect a lot of people. So that spirit of consultation was being brought up. The other aspect of nobility, human nobility, was brought up is equality. Is that it doesn't matter whether they are a group of cleaners and group of doctors, group of nurses, or combined all. We all realize that failure of one team will fail everything else. So that comes to that realization of those nobility characters. So for COVID-19, for me, it is a glimpse of unity. What can we get the benefit to humanity for unity? The drivers for unity is our human nobilities that will make it sustained for a long time and for us to enjoy the fruit of unity. But the concern for me as well is globally. Even though we here in New Zealand are fortunate that probably we haven't got community, we haven't got COVID here, there are other poorer places in the world where they could harbor this virus, and it's easily, if we open up the border, we brought back here. So we either take everybody together or we go down together with COVID-19. So that's what everybody was saying. At international level, we need unity there. In a local level, we have a little glimpse of it in New Zealand, and we love it in here at this time. But yet, we should not drop our guard. Thank you.
Thank you, Viliami. I feel like all the panelists have highlighted in different ways the lesson of our interconnectedness that this pandemic has taught us. But also at the end, Viliami, you highlighted the fact that regardless of who we are, we had this risk. We were all kind of in this experience as a community, global community together. But at the same time, we know that some people are more affected or have the risk of being more affected than others. So that kind of goes to our next question, which is what segments of our society have been most severely affected by COVID-19 in New Zealand? And then I'll get Dessi to share maybe if she has any experience thinking where she's living and working, and then kind of globally as well. Huti, would you mind addressing this question first?
Sorry, was that the next question, Ali? What segments of society?
Yeah, what segments of society?
Sorry, yep. Okay, so obviously those who live in communities with a prevalence of chronic disease were the ones most severely impacted, which was in this case in New Zealand were the elderly. But there are a lot more communities across New Zealand who suffer from disproportionate burden of ill health, such as Māori and Pacific Island people. And this is because they experience inequity more than other communities do in New Zealand, and they suffer as a result from higher levels of chronic disease than others. So I think the great success of the New Zealand's response is that those communities were well protected. And, you know, I think that these are the ones who were most at risk, but in reality, the ones who were most severely impacted, in my view, were the elderly. And obviously, because they are more likely to suffer from higher levels of chronic disease than other groups in the population. I also think that, you know, during the outbreak, during the lockdown period, was very telling in terms of those segments of society who also live hand to mouth, the poor. And this was never more evident once again in my own community, where, you know, you would expect that some of us would at least be able to stock up enough for a week. There were people who were in trouble in just a few days. And so this showed to me, you know, how critical our current system is. It's not really looking after those who need it most. And so one of the things about, you know, the Viliami mentioned about how he saw that our communities have great capacity to unite together to support each other in this time. That is what we saw in that period. Kia ora.
Thank you, Huti. I think that's a really good way to start the discussion, kind of highlighting the key populations that have been most at risk and then most affected in New Zealand. Sunil, could you continue on from there?
Sure, thank you. So yeah, I guess New Zealand's experience is a little bit interesting because the cases that we've had have largely been among travellers, you know, people coming back into New Zealand and bringing the virus with them. And those, by and large, that group have been relatively affluent and relatively young. So the ones bringing the virus in actually have not necessarily been at high risk of complications themselves. But we have seen, of course, when older people have been affected, of course, it's much more risky. And the outbreaks that we've seen in aged care facilities have been really difficult and heartbreaking. I think, you know, there was a comment from a colleague that the virus in the early stages was, you know, almost had a bit of an equity focus because Māori and Pacific people were not seeming to be affected in high numbers. But I think that's partly just a function of the way that the virus has come in and who's, you know, the demographic group that's brought it in. But we have also seen cases among people, for instance, working at the border or working in rest homes, or who then are not as able to protect themselves or their households from further spread of the illness. So it is really interesting. I think it's very telling that you know, pretty much every disease or epidemic that we've had in New Zealand, if you look back, the people who are, the groups that are affected the most are those who have the least resources to manage the situations. And I think that the risk for New Zealand going forward is that if we get more cases, those who are least able to, for instance, isolate or quarantine or access, work from home or stock up on food supplies and other things, are really the ones that are most impacted. And if I think about some of the cases that I've been able to review at a little bit of a distance, there's impact. There's just the numbers of people getting the illness, but then you think about, okay, well, this person lives in a family with 12 other people, and what's the impact on, you know, you have higher risk of someone else getting it, and then you have much, much higher risk of very long periods of quarantine for the household. So we've seen some families having, you know, up to 6 weeks of not being able to go out, and loss of income, loss of ability for the young people to access school and education. So it's interesting. Partly it depends a bit on how you measure impact, and partly it depends on the stage of the epidemic that we're looking at and who we actually see affected. So I think, yeah, we do really need to be paying more attention to those who are most vulnerable, and not having assumptions that everyone has the same level of resource to be able to deal with something like this. A shock, either shock of the illness itself, or the economic shock of losing jobs, not being able to access income, and so on.
Thank you, Suniva. Yeah, I think you presented a really interesting kind of difference between how we measure impact. So impact could be actually just getting the virus, or having to quarantine because you've come in at the border, but then impact in the long term with the economic impacts and kind of the long-term health implications can be quite significant for other populations as well. Viliami, would you like to continue on from there?
Yeah, sure. I think Suniva and Huti have touched on it, but I think there's the direct effect of the virus in terms of more affected the elderly and comorbid people. And luckily, as Suniva said, it hasn't been like the experience overseas. But I think of concern is the virus has unraveled the socioeconomic, mental vulnerabilities of some sectors of the populations, including Marian Pacific. They're going out of work. And I think the implication of that is something that is ongoing. And I think stem from the fact, as Sudi says, the inequity and inequality. And I think that's something at large for the government to look at. But I think what strikes me in the immediate effect of the viruses is the help within the families, the contact within the families and the help, but also in a local neighborhood where each and everyone asking whether everybody's okay. So there was an immediate help in there, plus also from the government welfare. But I think it's the long term, how we move on from now is the recovery period on some sector of the population, which seems to hit hard more than others, of the knock-on effect on the social aspect of it, economic aspect of it, and mental aspect.
Thank you, Viliami. Now I will ask Dessi to share maybe from her experience in her immediate environment, but then what she's doing with her work, if you don't mind.
Sure. So just like all the previous speakers said it, obviously the most vulnerable have been the elderly. But I want to highlight about the elderly and elderly institutions, because this is in every country that we see the greatest percentage of infection is of elderly in institutions, not ones that are at home, which makes me think how wrong our model of care, elderly care currently is. In the Baha'i writings, we do say that in the future, every community would have a home for the elderly, for those who need medical care, but the model we have now is not based on service. It's not based on joy, and the world is experimenting in making elderly people's homes friendly for aging. Like the Home Instead has a whole sort of franchise to offer that model for the elderly to age at home. So I think we need a lot more thinking, especially in the context of our healthcare not necessarily fully covering the elderly. The second group that has been extremely vulnerable, yes, exactly, the poor, and specifically the ones that are engaged in the gig economy. A lot of the research is talking about the future of work, and the future of work would be based on gig economy jobs. Like, we're quite privileged to have a full-time job and here at the World Economic Forum, we all know that it might be our last, full-time job, because the world is moving into these, especially in Geneva, like with the international organizations that are based on donor funding. Pretty much everyone you're surrounded with is on a 2-year contract, 4-year contract, and that's still quite protected. But what about, the Uber drivers, or the ones that are, driving their income from renting out their one room with Airbnb? We have all the stories or the story of the Indian chap who died in his Uber. Or in the US, yesterday there was an article that somebody recovered and went home. Even though he had health insurance, he got a bill for 1.1 million for his treatment in the hospital for COVID. So I think that we need more safety nets. On the one hand, I've been thinking a lot about has COVID taught us that we have come to the point in the world where we need to think about universal basic income? Or like, does our collective consciousness need to suffer more to know that we've reached this point where we can trust that people are like focused on service and the income, and they'll be somehow secured with a basic income, such that they're not driven by fear of would they be fired, etc. But frankly, I don't see very much being done in the direction of solving for how are we going to create safety nets for the people in the gig economy, as well as for the aging in this ageist society, both in terms of keeping people in their job, because we know as we age, we're more likely to be vulnerable to chronic diseases, and for an employer is actually quite much cheaper not to have such individuals. And we've seen in quite a few countries, governments like in Japan, Singapore, are now implementing policies to keep people employed. And then with that, I want to highlight one around mental health that we hadn't talked about here so far. We've all heard that mental tests would be a big part of the life of the Western societies. And I think this insecurity is especially, studies show that it's impacting the youth actually more than it's impacting adults. And I think now the Wellcome Trust is spending a big deep dive to try to understand what is it that is impacting the youth, so that we as parents and as society can provide the right safety net, so that as they start and enter the labor force, they're not starting with fears and anxiety, but feel empowered to fulfill their potentialities.
Thank you, Dessi. That was, really insightful, nice kind of exploration of a few different areas that have been most affected and people in different groups. I've seen a couple of hands raised, so we'll have time for questioning after all the panelists have spoken and addressed all the questions. So prepare yourselves for that. So we'll move on to the next question, which is, what is the role of trust and cooperation in public health? And I'm quite interested to hear about this, because I know in New Zealand we've had quite a trust-based model in terms of our response from the government. So I'm interested to hear your thoughts. So we might start with Viliami. You're still on mute there, Viliami.
Yeah, I think central to all of this is trust, as we know, where a lot of virtues converge in trusts and being trustworthy. And I think the model that we use for everybody to trust everybody to get out of this was quite obvious. Is one team of 5 million people, one has to trust these others, and I think that's well being demonstrated in here. But I think in a bigger picture, going forward from here in terms of trusts, just remember that this COVID-19 affects everybody. When we come to specific diseases and specific problems, then we can see a differentiation of ethnic group affected more than others. And that level of trustworthiness would has to be manifested in that. But for now, in terms of COVID, we can see the trust that entails from everybody, and our politician and institution and everybody has somehow come to fruition, and we taste a good taste of it now, and something to take and learn and move forward with that trust. But it's absolutely crucial.
Ali, you're on mute now.
Oh, oops. Thank you, Viliami. Puti, would you like to go next?
Thank you, Ali. Well, I think we've seen mistrust across the world, and that's mainly populations who have, you know, been part of countries where leaders have not been probably as successful as New Zealand. So public health has its basis is about collaborative partnerships between people, communities, organisations in the health sector. So trust is key, and obviously in a mature country where people respond collectively to a threat such as this, such as has happened in our country, you've seen quite a unified action across the country, which, you know, is just amazing, really. And so there are some, I guess, societies where you have that level of trust, and it is absolutely essential to being able to combat a threat such as infectious disease. So the role in public health of trust and cooperation is something that's always been intrinsic to public health, because public health deals with social, economic, political, institutional, and cultural environments where behaviours take place. Then, you know, trust and cooperation have to form part of the relationship that each of those protagonists have with each other. In terms of the spiritual lesson that we can take from this, I haven't really prepared this. I haven't really thought about that enough, I think. But I would like to hear from some of the other participants just to see, you know, what you think about this. Kia ora. Thank you.
Thank you, Huti. Yeah, I think from my limited understanding of public health as well, it does require a lot of trust in our public health institutions or government to be able to say, as a citizen, I trust that what they're saying is evidence-based, is the best for me and for my family, and that I want to cooperate to make it the best for everyone in our society. So it is, yeah, as you said, very intrinsic to public health, and we've seen that over this crisis period. Dessi, would you like to go next and share some thoughts on that as well?
Sure. So I wanted to illustrate that with an example of vaccine confidence. I fully agree with Huti and Viliami that trust is completely essential, but it's lacking today. And at this point, we don't even know whom people trust. There were a few studies that actually people don't trust their government, they don't trust their doctors, maybe they trust their employers, but do they trust them for health, or they just trust them for their income? And I think when it comes to now the vaccine development for COVID, a lot of the money that was raised, the I don't know how many billion by the EU, and the Bill Gates accelerator, they're all for vaccine and the therapeutic development. But when you pull the populations in Eastern Europe, for example, 21% say they're not going to take the vaccine because they think that you know, there's all the anti-vaxxer sort of movement saying that you know, they want to chip us and follow us, etc. So I think that the confidence in vaccines, that as public health experts we know is the most effective and efficient public health intervention, is illustrating that people completely lack confidence. And I think it goes back down to, you know, the community. We know, for example, with AIDS, a lot of the public health messaging happened with the hairdressers because people trust them, they're like everybody else. So I think as a society, we really need to think about, is it our faith-based communities that are going to give trust? But if that is the case, like, how do we give the right knowledge to those communities for people to be able to make the right decisions for them on public health? So, and even over the weekend, I was thinking about, and I saw that there was an announcement in the EU that 4 countries had actually created a collective alliance to do advanced purchasing of vaccines from one company when the vaccine is produced. But just the week before, the EU had actually created a vaccine alliance already to do the exact same thing. And then a week later, 4 countries break away and try to find a solution for themselves. So I'm a bit worried that we don't have, like society doesn't have confidence in vaccines. Countries are trying to fast track their development by finding shortcuts and trying to be nationalistic, which I think even creates people to lose more trust. So I'm really hopeful that we'll see more collective action and more engagement of people in this development process, such that people can trust that a vaccine that for the first time in history that will be developed in 1 year, when we know the fastest one was developed in 7 years, is actually safe, and communities are able to trust their governments, which now they're struggling to do so.
Thank you, Dessi. I think, yeah, that's a really interesting example to illustrate the importance of trust and how, if it's lacking, the implications of that for the rest of our society. I'll go to Geneva, who's going to share the final thoughts on this question.
I mean, I think this gets to the heart of the relationship between institutions, individuals, and communities, and that these 3 protagonists have been kind of locked in a struggle for ascendancy over each other for millennia. But we see that we really need to have that collective action in order to combat a threat like this. And so, yeah, it is obvious that the countries which have the highest levels of trust between those institutions and communication and collaboration are the ones that are going to be most successful and are showing to be most successful to date. I think, you know, the issue of trust in the institutions of society, unfortunately, different groups in society have different experiences of that, of the various institutions of the government, for instance, not just health, but, you know, police and justice and education and all that. And unfortunately, those communities which are most disadvantaged are also most likely to have lower levels of trust. And I think that that's something that institutions of society really need to take seriously and learn how to collaborate and learn how to engage people and build that trust again. And I think, you know, the attention being paid to the most vulnerable in society is one way that institutions can do that. I think about this, I was thinking about this quote from Baha'i, which says, tell the rich of the midnight sighing of the poor. And with our society, we need to have voices that can share the perspective of those who are less advantaged and make sure that those perspectives are brought into any solutions that we develop. Because if we just make assumptions and think that everyone has resources to, you know, do things like isolate or quarantine or stock up on food and all that stuff, then we're not going to have solutions that will work for everyone. And that does erode trust, actually. So I think, yeah, this is definitely something that worldwide, every country and every society has to learn about. And eventually we're going to have to learn about having the institutions that will be able to do this for the whole world, you know, even bigger than the nation or the groupings of nations or the European Union or whatever grouping it is that we're going to. And I think this is an experience like this is is bringing to people's attention that we do actually need to develop those institutions.
Thank you, Suneva. Thank you all the panelists for sharing such really well thought out experiences and perspectives about the importance of trust in public health, and I guess cooperation with community and with institutions at different levels, because we know that if it's public health, then the public has to have a say in how it's going to be governed and organized for them to put their trust in that process. And so we'll move on to our last question tonight, which is applying some of the lessons from our response to the pandemic. What should we do to have better holistic health outcomes for all segments of society going forward? Could I get Dessi to share on this one first, please?
Sure, that's the $1 million question. Well, when I was thinking about it, one idea that I wanted to share was around this new movement of value-based healthcare, which is about sort of paying health services and health products for the outcomes that the patients receive. And the idea is that outcomes are defined by patients themselves, as well as the payer and the government, and then there is a risk sharing between the beneficiary of the service and those that provides it. So, you know, in a way, in a case of a diabetic, you're not paying for the insulin that the diabetic patient is receiving, but you're paying for the ability of the diabetic patient to run a 5K, for example. So thinking about, could we create the future of healthcare whereby all the patients are responsible enough to follow the treatment plan that they have, such that they can pay for what they actually, the health outcomes that they actually receive, could be potentially one piece around it. And another one is really a spiritual perspective that I too, as when Huti was saying, she's still reflecting on how that can be applied, but the importance of prayer and meditation, we've now heard so much, and New Zealand is actually quite a champion in that. I'm aware that the government is looking into creating a framework for assessing technologies for improving mental health. We now know that all the apps, etc., that are out there, only less than 5% are clinically proven to have better outcome. But then how do we actually bring spirituality, which might not have, you know, clinical evidence that necessarily helps other than the impact of meditation that is studied? How do we bring spirituality and really hope and faith that spirituality brings into the individual, and that drives ultimately health, because we know mental and physical health are so interconnected. So this is my initial reflection. I'm really curious to hear the thoughts of the other panelists, and also the distinguished group of audience that I think will have joined today.
Thank you, Dessi. Huti, would you like to go ahead and share some other thoughts on this question?
Well, the role of trust and cooperation in public health. I mean, like I mentioned it, you know, cooperation and collaboration is intrinsic to how you work within public health. It's really fundamental to it. Trust is really developed through relationships, building relationships, and relationships are key. And so I think that what's come out of COVID is a level of, I guess, opening of the heart, if you like, of many people in the community. There are people who are talking and supporting each other who didn't know each other before. And I think that that's an outcome of this threat. And I think that, you know, calamity always brings with it some positives, and these are some of the positives that's come out of it. In terms of the role of it in public health, I think that really it's around building relationships, really sincere and authentic relationships, both between individuals, the community, institutions, and the health sector, and government as well. So yeah, that's my thinking at the moment. And I really appreciate the thought about bringing prayer to, because I have actually heard of a research that was done once on the effects of prayer, where they had a different cohorts that they who were prayed for and others who were not prayed for, and they measured the health outcomes, and apparently the group that was prayed for seemed to do better than those who didn't. And I can't find that, I can't reference that at the moment for you, but I've never forgotten it, and I think that that might be interesting to pursue.
Thank you, Huti. Viliame, I think he might have dropped out. Sunniva, would you like to go ahead and share some thoughts for the final question? And hopefully Viliame rejoins us.
Sure. I mean, I think if we think about overall health outcomes for all segments of society going forward, one thing is to not get all consumed by one issue, even if it's a very urgent and very pressing issue. We have to put everything in context. So we can't let the rest of our health systems fall apart, or, you know, not be accessible to people because we're so focused on COVID-19. And I think in New Zealand, we've seen a little bit of you know, people not accessing care that they probably did need during the lockdown, unfortunately. So we have to be really careful about the messaging and about the kind of how we help people understand relative risks of different things. So yes, COVID-19 is a big threat, but it's not the only threat that we're facing, and we need people to still be able to look after their long-term conditions and look after each other to be able to thrive more generally. I think one of the things I think about is that we have been more imaginative and creative in our solutions to some problems. For instance, I think about, you know, we've had long-term issues with homelessness, and during the COVID-19 lockdown, people suddenly started thinking, what happens if, you know, this gets into the homeless community? How can we support our communities who don't have access to safe housing? And we've managed to place a number of, quite a large number, I think, of people who had been living rough in motels for, you know, at least a good solid period of several months, which is not, you know, it's not necessarily a permanent solution, but it has shown that we can think about things differently, and we can use resources that are available differently in order to meet everyone's needs. And I think that's one thing that we need to take forward kind of as a principle, that let's focus on what's important. Let's focus on looking after people, not just for the period of an emergency, but longer term. And ideally we'll learn something out of our response to this challenge that we can take forward, that we can make sure everyone has housing and food and income and just means of livelihood and means of flourishing.
Thank you, Sunniva. Yeah, I think you highlighted really well the fact that even though we're in the throes still of a infectious disease crisis on a global scale, that the main I guess burden of disease that the world faces right now is in chronic disease and non-communicable illnesses. So I guess we'll go to Dr. Viliame, who's back with us, who can share maybe some thoughts on this last question yeah, from the perspective of a physician who is working in chronic disease management.
Yes, thank you. I think with my answer to the first questions, I find it very hard to move forward and create a better world without having unity in us, in everything that we do. It also can't help thinking about our human ability to drive all of this. But it's as we all know, the people out there that make these decisions have to work the direction. We have to give them advice. But I think from us, in terms of chronic disease, and COVID and chronic disease, and particularly COVID, have taught us is that the implementations of work out there is very strong if we focus not on individual, but family and community, and really a community building exercise. Whatever it is, but if we focus on a community building, and that's exactly what we're doing anyway at this stage, it shows to be a strong, be strong in terms to get results. And we know that from COVID in this way, even though it's a shorter term, but longer term, we need that. And I think that's lacking in our current way of approaching, but also in terms of approaching public health and health promotions as a whole, it's sometimes hard to actually put resources into things that will come into fruition in about 20, 30 years' time, given that some of the decisions have to be made by people that has to be elected in the next election. So there's a lot of things that are involved in this, but one thing that for me is the implementation in a family and also in the community. But one other thing I think about COVID-19 and what it shows that in a more global level is that the health of the planet, the planetary health, it's now, the world is so small that planetary health is absolutely crucial for our health to have a healthy planet. And it probably COVID-19 has probably in some way teach us that we are increasing numbers in the world. We're having more communication with wild animals. And we don't exactly know how the COVID-19 come to us, but it just shows the issues of planetary health that we need to actually take care of that because we are so small now. Thank you.
Thank you, Dr. Viliami. And yeah, I think that's a really nice way to end up the questions that we've posed to the panelists today. I'll kind of open the floor to questions. So if you have any in your mind, please type them down in the chat and then we'll ask the panelists. If anyone would like to also ask on screen, then please feel welcome to do that. I know we have some health professionals from other fields in the audience. So yeah, if you'd like to pose a question, please raise your hand and then I'll call on you. I think there was a question a bit earlier that that Kathy asked, which I thought was really nice. And it kind of relates to an aspect that we haven't talked about too much yet, which says, from a mental health point of view, were the health services well prepared to utilize their spiritual support? And thinking about, the spiritual well-being that we've seen also plummet a bit during this crisis. If anyone would like to speak to that, any of the panelists, then please go ahead. Puti, would you like to start us off, seeing as you're working kind of...
Can you just repeat that again, Ali, please?
Sure, I can. So it says, from a mental health point of view, do you feel like our health services are well prepared to utilize spiritual support or tap into any spiritual values in their approach?
Well, I'm not familiar with mental health services outside of my region. Mm-hmm. My interaction with mental health services has been quite limited to mainly the practice that is delivered here in our area of the Tairāwhiti. It's very much Māori based. It does have a spiritual element to it. There are, cultural practices that are employed in it. I think that it's an alternative to what has been normally the mainstream. And I think it's very important that there's a spirituality in whatever it is form that people believe it to be, is part and parcel of an approach to mental health and mental health wellness. Thank you.
Thank you, Huti. Would anyone else like to share some thoughts on this one?
I would just say that from a global perspective, I never hear anyone talk about spiritual principles or taking spiritual considerations into mental health sort of practices. So I find that we still, whether we need to define what a spiritual intervention is, and then we need to kind of make it less stigmatized, that it's like a organized religion or something like that. People talk about the effect of meditation, and quite a few insurance companies have said that the mental health visits have almost 5 times increased visits online to a therapist, and that the meditation is prescribed, but not like anything more defined as like a spiritual practice or the likes. I'd be curious to hear others whether they've encountered spiritual advice from physicians or mental health services.
It's not part of the formal system. It's part of the treatment, the spirituality. It is acknowledged, though, about this treatment, and I think everybody from a Pacific people have got the 5AR or church ministers or those groups where they seek from there. But I guess it touches on a broader picture of health promotions, and in particular 2 aspects. We got the Ottawa Charter, but I think it's 2 particular aspects that we haven't really addressed well, is spirituality and culture. And I think it's absolutely vital, those 2 to be addressed, and something that need to be infused or get into the health promotion and primary health, as the interdependence of various factors need to move forward. And I think Sione, being in here, knows the health promotion model that the church group, the Church Leaders Fellowship, we agreed on is the 6 domains, the interrelationship, and the need to move those 6 domains forward for the overall well-being of people in terms of the mental health, physical health, spiritual health, culture, environment, and economics. They must be moved ahead, all of them, for the greater good. But I think in the Ottawa Charter, even though probably mentioned, it's not really get onto it more deeply, particularly ethnic group, particularly Pacific and Maori, that culture and spirituality hasn't been adequately assessed, acknowledged or being used.
Thank you, Viliami and Dessi. I think you've both highlighted the fact that we do have some way to go before we're really kind of getting at where we need to be with utilizing spiritual principles and spirituality to help heal our communities. There's a question here that says, we have noticed a reduction in the number of sick days for employees who have been working from home. Is working from home something that should be encouraged from a public health perspective? It's quite an interesting question. So if you have any thoughts, please do share. Maybe Suneva, if you mind kind of opening up, if you have any initial thoughts.
I think it is interesting to think about how this experience with COVID-19 is changing a lot of things in the way that we do business. Kind of across multiple sectors and segments of society. There's probably some clear benefits to the planet and the environment if people are able to work from home, in terms of, reducing traveling and carbon emissions and all that sort of stuff. I'm not really familiar with, there's probably is emerging research on this, but it's not something I've looked into in detail, but I'm thinking that I'm sure it will go both ways, because people can feel a bit more isolated human connection is really important to maintain. And yeah, I think there'll probably be different ways and different. I think about in health in our organisation, you know, there's been a move towards telehealth, which is trying to use telephone consultations and video conferencing and things like that for clinical interactions. And, you know, that was kind of forced on us in a rush when it came to lockdown for a lot of things. But the idea is for it to be carried on further. But I think we do need to be quite careful on how we do that and say, okay, maybe it has some benefits for some people in some situations, but maybe it also has some downsides and some, you know, we have to think about people who may have less access or, you know, that may not be a preferred way of operating, or, you know, there's multiple factors involved. Happy for others who are more.
Yeah. Could I just contribute something there, Suneva? We've just been working on a new model of care to roll out across our area. And of course, we've been proposing to the community, for the various communities for some time, that we move to telehealth due to the shortage of doctors that we have in New Zealand. And it's very difficult at times to get doctors to those remote areas. There was a real resistance, but there isn't anymore. So COVID has really opened people's minds up to thinking that, you know, this is actually the way of the future. Of course, there still needs to be support, you know, within the clinics and grassroots and what have you, and that human interaction that you talk about, particularly for those serious cases. But in general, for, you know, GP work, general GP work, we hope that, well, our communities certainly seem to be a lot more receptive. So, yeah.
William, please.
Yeah, just to add on, I don't have the experience of working from home, but the experience of patients staying at home and us bringing them. And I think for us in the hospital, it becomes now that we need some patients that will be able to actually ring them and do telehealth. And one aspect of it, which is quite useful, is that, remember, dealing with chronic disease, a patient may have about 10 appointments in a few months. And remember, these patients have got other responsibility. They've got kids and all those and to do. So it's not surprised they don't turn up to clinic. So there is an influence in improvement in compliance, just because we relieve the pressure of having to drive 10 times in a month to hospital or to clinic. So there is, the COVID-19 has forced upon us and to continue something that we haven't able to do, we didn't actually done before, to the benefit of the service user.
Thank you. Yeah, interesting perspectives about maybe forward movement for healthcare provision in the future. I've heard Sione Tuatahi would like to make a question or comment. So please do that. Yeah.
Thank you, Ali. On two points brought up by the panelists. The one on spirituality, if we go back to the 1948 definition of what health is by the World Health Organization, it did not touch on the spiritual dimension of well-being, but later on it was incorporated. But still the dominant discourse and thinking, and therefore the approach to health, is still physical and mental, and to some degree social. Health promotion as a professional practice and as a field in health is more open to the spiritual dimension of well-being. It is not explicit in the Ottawa Charter 1986, but it's in the Bangkok Charter 2007. Spirituality is mentioned there, along with Indigenous people's health and well-being, but also it's a framework that was purposely established to address the world being a global society, And with the increasingly significant role of the commercial sector, and to address, therefore, commercial determinants of health. Abhiramya referred to one particular model on health and well-being that we have adopted. We evolved from the Tongan community. It's Fonuaola. It has 6 dimensions of well-being, from the physical, spiritual, ecological, socio-economic, cultural, and so on and so forth. And our interfaith leadership network in the Tongan community that we are members of, William and I, have adopted that as the model to propagate within the Tongan community. It's similar to other indigenous models like the Whare Tapawha, Semezanduri, the Whanowhare, Fuimano, Ka Polotu, Andaman. And it's not just this part of the world in terms of the world indigenous community. You find that notion of humanity being one, not only with the environment, but also the relationship between the physical and the spiritual is not, it's quite fluid and close. In fact, they are one, whether it's how knowledge are sourced or the journey of people in life, and from the world of the womb to this physical world to the next world, is one seamless journey. The term for Noah, that's what it means on a number of stages. There was one other point that I was going to mention, but I think I'll leave it there for now. Thank you.
Thank you, Sione. Giving us some more background about ways to approach health promotion and kind of public health within the New Zealand context as well, especially around spirituality and emotional and mental health. I think we have one last question from Nizar Mohammed. You can unmute and speak. You're still on mute, sorry. There you go.
Yeah, this is more of a comment, following up on some of the issues that the speakers talked about, which was about trust and unity, because those have been very, very important all over the world. There was a report put out in October 2019, the Global Health Security Index by Johns Hopkins University, funded by the Gates Foundation. And in that, the top 2 countries that had the best systems in place, both in terms of infrastructure and in terms of scientific capability, were the United States and the United Kingdom to deal with pandemics. And yet those 2 countries are in the top 3 of countries that have been affected by the pandemic. That demonstrates how these were taken on a scientific basis, but they did not look at the soft issues of trust, leadership, and unity. So that was a comment I had.
Thank you, Nizar. I think you raised another really important concept, that the way we measure our health systems is also very flawed. Dessi, would you like to offer some final comments on what Nizar shared?
Yeah, I think that Ali, you summarized it very well, that the way we measure things is very flawed, and it could be that we're not taking into consideration the holistic aspect of the people that are part of the health systems. Because if you look at the framework for health systems that WHO put together some 15, 20 years ago, it has all the protagonists, the health workers, the providers of pharmaceuticals, of medtech, financing, but it doesn't have the individual. So probably until we take into consideration, you know, the individuals, it does have governance as a key driver of the assessment, and that assessment of the Johns Hopkins also looks at governance, but it's so difficult to measure governance really that that maybe it's the focus on the individual and the understanding that our inner, you know, the response depends so much on our inner health and the focus on truly unity and service that would drive outcomes. So whatever you can simulate before you can never predict it until the situation comes and the individuals and the communities and the institutions mobilize to respond.
Thank you. Definitely. I think we'll continue learning a lot from this COVID crisis as other countries respond in different ways. So we have in New Zealand, and I guess I'm sure in a year's time we'll see lots of publications trying to analyze different things around how different countries have responded or what we can continue learning to apply to our public health models. So if there are no other questions or comments, I think we're nearing our end time, so I'll draw the discussion to a close. I'd just like to thank again our panelists, Huti, Geneva, Dessi, and Viliami, who's still here, maybe has left, might have dropped out again. Thank you so much for offering your thoughts and your time and your expertise to us to, I guess, broaden our perspective about this pandemic and what can we continue learning about it.